Welcome to Heart Dialogue, where we believe that meaningful dialogues have the power to inspire, heal, and connect us on a deeper level. In this podcast, it's also about gathering and lifting a whole community up. Let us stand in response to people's cries and generate a current of dialogues for a better world. Let's HTHD!
The company itself actually uses the Fundus image, which is the image at the back of the eye, to not only detect eye disease, but using the same image, we are also able to detect diseases of the body.
So we are using the AI, artificial intelligence,
That's right.
to do the detection.
That's right. So diabetic retinopathy is a problem that happens in 1 in 3 diabetic patients.
Wow, interesting, super interesting.
So basically, this is, as you can see, the camera is actually talking to the patient.
Yes. Do you know that blindness is actually a type of critical illnesses? And blindness may not seem life-threatening, but it is definitely life-changing. And according to research, there are few reasons who mainly cause blindnesses: glaucoma, diabetic retinopathy, macular degenerative, cataract. And that's the reason why I'm having this episode today with my special guest. Once again, welcome back to Heart Dialogue. And before I introduce my guest officially, let me share with you a little bit of what they are doing here. It's very unique. And they are definitely revolutionizing the detection of the eye disease. And I would consider them as the future of the retinal diagnosis. Okay, let's welcome Stephen from EyRIS.
Thank you very much, Candy, for inviting me to this show.
Thank you,
I'm really
Stephen.
excited, and thank you.
Yeah, definitely. Before we start to share more about what you're doing, Stephen, could you share about what are you doing? What's your role in EyRIS?
I see. My name is Stephen, and I'm actually the Chief Strategy Officer for EyRIS. It's a company that is headquartered in Singapore and has been around since 2018.
2018.
Yeah, so the company itself actually uses the Fundus image, which is the image at the back of the eye, to not only detect eye disease, but using the same image, we are also able to detect diseases of the body, such as kidney disease and risk of heart disease.
Okay, so sorry, because I'm a layman, I need to pause a little bit.
Sure, no problem.
Okay, so what you are doing here is you are using, like, imagine this is the eyeball. So you are using the image at the back of the...
Yes, that's right. Retinal.
Retinal.
Yeah, that's right.
Okay, so you captured it to have sort of like a pre-detection.
No, we actually capture the image. Then what we do next is okay, let me take even one step back. Before even we can come to being able to detect the different disease using the images, we first have to train an artificial intelligence in order for us to be able to recognize the different disease.
So we are using the AI, artificial intelligence.
That's right.
To do the detection.
That's right.
Okay.
And in order for us to do that, we need to first feed the AI through deep learning a lot of information about what is normal and what is abnormal, so that the AI is able to detect what is abnormal.
Wow, okay.
So primarily when we first started, it was to actually just detect eye problem, such as the different diseases you mentioned earlier, like diabetic retinopathy, glaucoma, AMD. And but over time, we also realized that the same image is also able to detect other parts of the body, diseases in other parts of the body. In fact, interestingly, we have an upcoming product, actually a product that is already available for our overseas client, but in Singapore, we are still trying to get the regulatory approval. We have a product that's called Bioh-H.
Bioh-H.
Yeah, it actually compares your biological age versus your chronological age.
By just using our retina image?
Yes, that's right. Very interesting, isn't it?
Definitely.
Yeah, the reason being is because the blood vessels at the back of the eye are a certain set of blood vessels that are actually developed when we are all in our mother's womb.
Okay.
Those blood vessels are basically called embryonic blood vessels.
Embryonic blood vessels.
That's
I'm
right.
learning.
No worries. I'll go slow. So the same set of blood vessels are actually also replicated in the brain, the heart, and also the kidneys.
Okay.
And the research over the last 20 years have shown that if there's any disease, the changes in these blood vessels is actually very much consistent. be it in the back of the eye, the brain, the heart, the kidneys. The only problem is all the other organs where we actually have these embryonic blood vessels, you only can see them through a CT scan or MRI.
Oh.
And the blood vessels at the back of the eye are the only set of blood vessels that are superficial enough to be taken with a simple fundus camera. Okay, it's still a special camera, but at least it's superficial enough just to be able to use the simple image of the eye.
Okay, so let me try to digest a little bit. So,
Sure.
Stephen, you are saying that these sets of blood vessel of the eye is kind of similar with the brain, the heart, and the kidney.
That's right.
But yet, the brain, the heart, and the kidney, these embryonic
Blood vessels
only able to detect via CT scan or MRI.
That's right.
Which is cost a lot.
A lot of money. That's right. Yeah. Whereas for the back of the eye, it's a very simple fundus image, which can be taken easily with a fundus camera.
Okay.
Yeah.
So this is how EyRIS established.
Okay.
At the first.
Okay. EyRIS the first problem statement for EyRIS was to help detect diabetic retinopathy. So diabetic retinopathy is a problem that happens in 1 in 3 diabetic patients.
Wow.
Okay.
The ratio is about 33 to 34%.
Yes, that's right. That's right. And basically, the only way to actually treat this particular problem is only through early detection. And when you actually pick up this disease really late, usually the patient will still suffer from some sort of a visual impairment or sort of a blindness. And in severe cases, they usually go blind.
Can they get cured?
You can only totally cure this problem when you detect it early.
I see.
When it's a late stage, it is usually very difficult to treat. And even if you treat him successfully, you will not be able to regain 100% of the vision. You have to bear in mind that 1 in 3 diabetic patients, and diabetes is a big problem.
Yes.
Right. And it's an exploding problem, not only in Singapore, it's across the world. Correct. As the more and more societies getting more and more affluent,
yes.
It is a big problem.
Yes. Okay, so maybe we go back a little bit.
Sure.
Could you share with us, right, which group of people are actually started or founded this EyRIS?
Okay, the research was actually started off by a very prominent researcher in Singapore. His name is Professor Wong Tian-Yin. Okay, and he basically knew that this was he together with the government knew that this was going to be a big problem. So they started this particular program to actually screen all the people in Singapore. But unfortunately, they couldn't get enough people to sit in one location to be able to screen all the images of all the diabetic patients.
Yes.
Okay? So what they needed was, but with the information collected over the years, they were able to use that data to train an AI. And basically the group of people from the National University of Singapore and the Singapore Eye Research Institute are basically the researchers and the inventors of this particular artificial intelligence.
Wow. Phew, okay, a lot of information here to digest. Okay, so to put it in a simple term, EyRIS started with just as simple as to detect the diabetic retinopathy.
Yeah, that's right.
How does this get, evolve into what you guys are doing today with all this?
Systemic disease.
Yeah.
Actually, over the last 20 years, the research by the Prof Wong's team, especially the Singapore team, has always knew that the changes in the back of the blood vessels is actually related to systemic disease. Just that they were not able to correlate. They could able to correlate it, but they couldn't actually quantify it in a certain way.
Yes.
But it's actually true, and because this was actually all the data was collected in Singapore over many, many years, and we not only have a data of the patient in terms of what are the other disease the patient has, we also have the longitudinal data of the patient. So that allows us to be able to train the artificial intelligence to do what it does. And having an infrastructure to be able to screen for diabetic retinopathy is pretty expensive, because even today, all the polyclinics in Singapore, there's actually a fundus camera to take the image at the back of the eye. But if we can use the same infrastructure to be also able to detect other diseases as well, then there'll be better use of the infrastructure as well.
Is it kind of like bring down the cost, the medical costing?
Of course. The cost is able to pre-screen the patient and to be able to first pre-screen the patient for the patients that require further tests or further examination. I think that is something that I think that's what we are trying to aim to deliver.
I see. I mean, when we mention about the patients, what are the age, like the range of the age whereby you would actually sort of like encourage them to start to do this pre-screening?
You know, I myself, I'm a diabetic patient, okay? And actually I got diabetes when I was 30 plus.
30 plus?
Yes, scary, isn't it? And actually, I think nowadays, anyone from maybe 35 onwards, I think is actually a good age for actually health screening.
How do you get to know that you actually had diabetic when you were?
Actually, I felt really unwell, and I was just really, really unwell. And I went to see the doctor, and I was admitted, and I was actually given a full checkup. And only then I realized that I had a really, really bad diabetes. And I've been on medication ever since.
Wow.
So it's nearly coming to, well, I'm going to be revealing my age if I tell you how long I've been. But it's coming nearly to 20 years.
It's okay.
So,
age is just a number.
Yeah, that's right. Yeah, and it's a problem. Yeah.
Because I'm in insurance industry, right, for the past 6 years, and I do see people with 20 plus years old started to have diabetic and they have cancers and what's not, and definitely it's good to do a test or screening as early as possible, right?
That's right.
So for this EyRIS machine, is there any specific like age range that the detection would be accurate?
Okay, for the eye disease, the recommended age is anything above 22, 23 years old. Our system will be able to screen. So we also have other products that actually is more suitable for patients after 35.
Okay.
And also we have another one that is actually more suitable for patients after 40. Yeah.
Why are they having different sets of machines needed?
Oh, yeah, I don't think it's a different set of machines. We're still using the same machine, just that the artificial intelligence can only be applied for those group of patients. The reason is being the group of patients that the AI was used to train. To be really accurate, so for example, if we are using a particular age group to train the artificial intelligence, then we will want to basically limit it only to this particular range of patients. Yeah, because you will not be able, actually the AI is as good as the data is being provided.
Yes.
Therefore, because of the data that was being used to train, that's the reason why we limit it to what we are currently using.
I see. Just for the accuracy, right? Like,
yes,
because if we impose like too large for the age group, then may not be that accurate.
That's right. That's right. That's also because based on the data that was used to train. That's right.
Okay. And for example, right? Okay. Later, definitely we are going to do a demo.
Sure.
Okay, so you guys will be able to see like from the image itself, there's anything wrong within the image, or how does the...
Okay, for ophthalmic diseases, we mean for eye diseases, we can literally see where the problem is. In fact, we have an artificial intelligence that is able to actually annotate exactly where the problem is. In fact, it can circulate out and show you where the problem is. But for systemic diseases, you are unable to detect it using the naked eye. We only is actually using big data that's able to observe the microvascular changes that is actually happening in the blood vessel. That's able to actually come out with an indication. Okay.
Would there be a report?
Yes, we actually generate a report. We have a report that says whether you have eye problem, no eye problem, whether you need to see an eye doctor. We also have a product that's coming through with hoping to get regulatory approval soon that's able to detect kidney disease as well.
How does this kidney disease related with the blood? Oh yeah, you were mentioning the embryonic.
Yes, that's right. The kidneys actually have the embryonic blood vessels. So there's certain changes in the blood vessels that actually is indicative of this particular disease, and you can pick it up from the blood vessels from the eye. Yeah.
What are the kidney diseases that we are looking at?
So we are looking at chronic kidney disease. So our system currently, the one that's in the pipeline, is able to pick up stage 3A and above or 3A and below.
Why? Stage 3 and 3B?
So basically, kidney disease has 5 stages. Of course, stage 5 is the worst case scenario. Stage 1 is a milder form of kidney disease that usually can be detected through urine. Stage 3 is actually where you actually have what you call the EGFR, well, it's basically a blood test result that is actually indicative of anything below 60. So we are able to pick up EGFR result, which is actually a measurement of the filtration capability of your kidneys.
Filtration capability of the kidney.
That's right. Yeah, because the kidney is used to drain all the excess from the body. So we are able to detect stage 3A and above of our kidney disease, and we are able to indicate whether the patient requires further treatment by the nephrologist.
Wow, this is sounded really, really interesting.
Yeah.
Okay, then what about the heart disease part?
So at the present moment, we also have an algorithm that is in the pipeline to be approved in Singapore. It's actually a ability to give a elevated risk or low risk of heart disease.
Wow.
So low risk means that means you are basically not, you have a lesser chance of actually developing heart disease or stroke.
Like heart attack, stroke.
Yeah, that's right. Oh. If the system indicates that you are actually of a higher risk, it means that you are 7.5% higher chance of developing heart attack or stroke within the next 10 years.
7.5%, not 7.5 times, right?
No, 7.5% more chance. But it's actually a standard that is being used by the American Heart Association as well to actually measure, to basically risk profile a particular patient in terms of their cardiovascular problem.
Wow. Okay. Interesting. Super interesting. And if like, you mentioned about like getting approval, getting regulated by Singapore, right?
That's right.
How Singapore regulatory work? Is Singapore very stringent on?
Oh, Singapore is pretty stringent. So just to clarify, the products that I've described earlier are actually all got CE mark, which is approved for use in Europe. Oh. Right? Okay. And using the European mark, we are able to actually also enter to the different markets because it's sort of like a passport in some way to enter certain markets. So, and in the Singapore context, we're actually going through the regulatory body is actually called HSA, like Health Science Authority. And they're actually very, very strict. Actually, I think one of the stricter ones in the world. Wow. But they actually adopt what is going on across the world, especially in Europe, especially in the US, even in Australia. So, and is the benchmark itself against, actually when you mean regulatory, right, it actually means safety, right? So what the HSA is trying to do is actually to ensure that the product is safe for use, right? And it's actually giving the correct information, and that's their job, right? So, but the standards that is adopted by HSA is actually very much a very international, very international standard, which is benchmarked against the CE mark, the TGA in Australia, and the FDA in the US. So I would say that the Singapore regulatory framework is actually pretty tight. Yeah.
Which is secured in a way, right?
Yeah, it's safe in a certain way.
It's safe. Yeah. So you mentioned about the safetiness. I just had a sudden thought, like, because this is a machine, right? And then it's going to take images. Is there any risk involved or any side effect if a person use this machine for multiple times?
Okay, if you use it all the time and it's actually not good because it may cause some damage to the eye. But I mean, this is not to be used like repeatedly all the time. I mean, it's supposed to be used to screen the patient once every 3 months, once every 6 months. Yeah, so you're not supposed to be using this repeatedly. Okay. But regardless, I think it's important here to clarify the technology. Yes. So what you see here in front of me with the camera, it is actually just a fundus camera. That means you can actually find this type of camera in most of the optometrist practices in Singapore. Yes. Okay. Just that this one is a little bit more portable. It's actually more easy to use, and it's actually autonomous, meaning that it doesn't require a specialized operator to operate the camera. Yes. So you could just it actually is fully automated. It positions the patient itself. But the technology that EyRIS is actually focused in is actually the artificial intelligence of the analysis of the image. It is not the camera.
Not the machine itself.
Not the machine itself. It's the software that is able to analyze the data after the image is being taken. So,
I see. So the machine here is just like the same as we went to the optometry shop and we took the test and all that?
Yeah, it should be one of the machines Most of the good optometrists in Singapore tend to actually have this machine. But of course, it comes in all forms and sizes. This is one that is more portable. Yeah.
Then you just input the software, the AI technology inside to kind of analyze.
No, actually, we extract the data from the camera and we analyze it on the cloud service, where actually it's on a separate platform.
I see.
So the analysis is this is purely just a tool to capture the image, and the processing and the reporting is actually can be done on your laptop. So software.
Okay, I see. And also when we are talking about this AI cloud data and all that, right? I definitely think that the audience would curious to ask how, how's the safety? How do you keep the patient's data? Like, for example, now I've taken an image of my eye and it processed in the iCloud. Then how would IeyRIS protect the data for us?
I think when we are talking about another branch of IT is cybersecurity and all that. We actually are compliant to the standards. In terms of cybersecurity, we actually conduct what we call a pen test, where we actually literally ask people to try to hack our system.
Wow.
And to make sure that we are unhackable. And also we subject our entire software for review. In addition, our service is actually hosted in usually those reputable cloud services like Google, Amazon, where they actually have their own cybersecurity in the first place. And that is an extra layer on top of what we are actually providing. Of course, that is actually the cybersecurity aspect of the software is actually part of the HSA regulations as well. So they actually require you to actually be certified in a certain way to ensure that your product is actually securing the patient's information.
So in short,
it's safe.
Yes.
That's right.
In short, layman term is safe. Yeah. Maybe we discuss something a little bit more lighthearted. Because I saw your LinkedIn today, like IeyRIS doing some project of eye care in Mongolia. Yeah, I mean, I'm not sure if you are comfortable to share, but maybe I'm just curious to ask, like, other than Singapore, where else, does IeyRIS having this?
Yes, we are working with a Sight for All, which is an Australian NGO that is actually trying to promote women in ophthalmology. At the same time, it's also helping to screen for diabetic retinopathy in the population there. You have to bear in mind that we are very lucky in Singapore that we actually have a government that is really taking good care of us in the way that we actually have what we call a Singapore Integrated Diabetic Retinopathy Program, where actually screening is being provided for.
Okay.
Whereas in many countries, this particular service is unheard of, right? And it's actually being done by ophthalmologists. So you can imagine, right? Ophthalmologists, the number of ophthalmologists to be able to treat all the diabetic patients is actually quite difficult, and it's literally a burden to any ministry. So our technology, when applied in certain countries, is actually very interesting. For example, currently we are also part of a national screening program in the Sultanate of Oman.
Oh,
okay.
Oman.
That means actually when our system goes live in May, the whole country will be actually will have their eyes screened, and our artificial intelligence will be triaging the patient in the country.
I see.
Right. And we also have a few other projects that is going to be implemented with the Ministry of Health in different countries. So for Mongolia, it's an interesting place because actually the population of 3.3 million, but more than a third of them actually lives in the rural area.
Yes.
So it's very difficult for them to actually have access to eye care.
Yes.
And our technology can solve the problem, especially with the way we have used the technology in terms of the hardware, where the portability of this can be deployed anywhere. I'm happy to do a demonstration later of how portable and how easy is it to use the technology.
Can this be hand carried?
Yes, it does come in the suitcase. And in fact, we are leaving for the Middle East later in the evening. Yeah. And we actually bring this camera with us.
Okay. Maybe we can go ahead with.
Start to capture macular centered image for both eyes in 15 seconds.
So basically, this is, as you can see, the camera is actually talking to the patient.
Yes.
So especially as you were talking about Mongolia and the deployment in the outfields, in the field.
Please stare at the flashing cross
it's actually
and try not to blink. Beginning the left eye. Please open your eyes and stare at the flashing cross.
Yes, you literally can see what the camera is trying to do, right?
Do not blink.
Wow.
Left eye complete. Close your eyes and do not move.
As you can see, can you imagine this? You do not need much expertise to be
Please
going
open your
involved
eyes.
if you feel
Beginning the right eye.
using this technology.
Stare at the flashing
You just need the
cross.
internet, right?
Yes.
To be able to take the image and then it will be
Focusing.
uploaded.
Do not blink.
And it's auto though.
Imaging complete.
Yes.
You may remove your head from the device.
Wow.
How is it? Okay?
Okay.
How's your experience?
Yeah, not bad.
It was just a flash of light, right?
Yeah.
Yeah.
Flash of light.
Of course, we cannot repeat
Wow,
it.
I can see the...
Upload image
Is it the
successfully.
image here?
Yeah, that's right. So the image is automatically uploaded onto our system. We can see over here.
Jamie, you want to have a look?
Kind of,
Oh, let me try. I think they want to try to... Okay. Computer screen, yes.
Yeah, so basically the image is uploaded. Can you scroll up, please? Thank you. Yeah, so basically, as you can see, we have like a blood test panel for us to be able to choose the different tests we request. And
diabetic.
yeah, that's right.
Okay.
That's right. So this eventually, as we go along, there's more and more algorithms that will be added onto our platform. And once you actually, and you'll be like, the customer just tick off which are the tests they want to run. So when you click submit, please, thank you. So this basically, the images are currently being uploaded into the cloud,
Okay.
where it's currently being processed. So because we're running all the tests, we run maybe about 60 to 90 seconds
Okay.
before the results comes back to us.
Which is quite fast though.
Yes, that's
60
right.
seconds. So if let's say at Mongolia, would they speak English or it has different...
Actually, it currently speaks English and Chinese,
Okay.
but there are opportunity for it to speak other languages as well.
Wow.
But it's because it's only that few fixed language, a few fixed command, right? So you just have to basically upload the translation in. Yeah, so that's what we're currently doing.
I see. Interesting. And there's only one camera, but the camera will move around, right?
Yes, that's right. It actually moves from one eye to the other. And you can see it's pretty automated, right? It doesn't require an expert guy to operate the machine.
Yeah, true.
Yeah. So basically, if it's going to be very difficult and this equipment is going to be very expensive, that is a primary barrier of entry for all the healthcare professionals to uptake this service. So with this portability and the price, the reasonable price, we are able to actually get this deployed more easily.
I see.
Okay.
This is the result.
Yeah, this is the result. You can show that this is he's actually good. He has no eye problem. He's non-referable, so he doesn't have to see an eye doctor.
Okay.
There's no detection of any abnormality in the image.
Yeah.
In addition to that, his kidneys are good.
Yes.
Okay. Even though he's 40 years old, he's actually biological age is 39, and he doesn't actually have a elevated cardiovascular risk.
Oh, interesting.
Yes.
Okay, cardiovascular risk.
Yes, that's right. So basically, this is actually how a report. This is actually the entire workflow of how an image is taken to the reversion of the data.
So, like for this, I'm curious. For this testing, right? So EyRIS only work with business to business, right? Not for the...
Yes, that's right. That's right. We are a B2B provider. Even though we envisage in a world in the future where we can go directly for B2C, allow me to describe what I see the world to be. So maybe we actually have a handphone. We actually have an app, and you basically choose the test you want to choose, you want to take. You go to a location where the cameras is available. You scan the QR code, the image is taken, it links the data with the patient's PII, personal information, and the results are downloaded to your handphone where appropriate medical advice can be given.
Wow.
Right, this is the way I envisage the world. There are still a lot of hurdles such as regulatory and how to be able to develop this network of cameras.
Yeah,
but
definitely.
but the possibility is endless to be able to how this technology can be deployed in the future.
Yeah, which is very amazing because if let's say the B2C, like we can just access to it like using our camera with the apps, right?
Yeah.
Yeah, this definitely going to be very revolutionized, I would say.
Yeah, it's very revolutionary the way we can actually approach the technology. At the present moment, it's still currently being used in different countries in health screening centers. Primarily in Singapore, we are encouraging this to be used in the private clinics, especially with the HTHD. But this is what the technology can do today. Amazing, isn't it?
Yeah, definitely is. And with AI technology, so long as we put it into good use,
Yeah, that's right.
Yeah.
That's right. Of course, artificial intelligence is never here to replace any human being. I think we must always use artificial intelligence as an augmenting tool to what we are currently doing, to be able to make us more efficient, to be able to make us do more things in a shorter period of time. I think that is what AI can do. Yeah.
Before we end off, I would like to ask Stephen, if I may, what could be the vision of EyRIS in the next 5-10 years?
We hope to be able to develop more algorithms coming through. At the present moment, as you can see, we are basically detecting diseases as of what the patient has today.
Yes.
The technology today, in fact, we have algorithms in place where we're not only able to detect what you have now, we can predict what's going to happen in 1 year, 3 years, and 5 years' time. As I mentioned earlier in my talk, right, in my description, we actually have longitudinal data. That means we have data that runs from 1 year, 3 years, 5 years, 10 years. And using that longitudinal data, we are able to take an image today and predict what's going to happen in 1 year, 3 years, or 5 years' time. That is amazing, isn't it?
That's very powerful.
And not only are we going to be able to detect eye disease, but the technology is coming where we are also able to detect, the likelihood of you developing kidney disease or heart disease and all this. So I think, it is truly the healthcare, especially using such technology, is really moving towards prevention, which I think is the main thing today, right? And that's the most important way to be able to reduce costs, not only for the patient, but for any country.
Yeah. Prevention is better than cure. Right?
That's right. You're absolutely right.
And what could be the one piece of advice that you could just share with the audience here?
I want to say that for those patients who actually have diabetes, it's strongly encouraged that you should go and have your eye tested at least once a year. That is the protocol given by the United Nations, by the World Health Organization. Okay. And if you when we roll this technology out to more and more clinics, I hope that you can actually deploy and experience how swift and how easy is it to deploy such technology, how this technology can bring a lot of convenience to you.
Cool. So if let's say right now they would like to deploy this technology, where else can they go?
They can always, for any clinics or doctors who would like to deploy this technology, please drop us a message, either on LinkedIn or basically write us an email. Or visit us on our website.
Okay.
Yeah. Thank you.
Thank you. Thank you, Stephen.
Thank you very much. Thank you, the whole team. Thank you very much. Cheers.
Thank you. I learn new things every day. See you guys again. Bye. Thank you for being part of this incredible dialogue. We hope this episode has inspired you to embrace heart-to-heart dialogue in your own life. If you love to share your stories with us, DM us, comment below, or use the hashtag HTHDstories. Your voice matters, and we can't wait to listen and learn from you. If you enjoyed today's conversation, don't forget to subscribe and share this episode with your friends. Remember, every genuine conversation has the power to make a difference. Let's make an impact together. Till next time.